For patients considering going to medical tourist clinic, and if you are a patient of African descent, please do not go for hair transplant abroad. If you haven't seen any dermatologist or any hair transplant surgeon who specialize in Afro-texture hair, rule out any scarring alopecia before embarking in a journey for hair transplant because you may regret it. Hello, I'm Dr. Christian Bisanga in Belgium, and I'm a hair transplant surgeon. I've been practicing for the past 25 years, and I am specialized in repairing hair transplant from medical tourism with a butcher hair transplant, and then we have to fix and repair them.
If you are specifically a person of Afro descent, there's a lot of inflammatory scarring alopecia. There's so many treatments. You can get growth without necessarily having to do a transplant. So please do your due diligence and get your scalp evaluated first. Very recently, I had a gentleman who presented with large nodules filled with pus 2 months after having a hair transplantation abroad, and he had something called dissecting cellulitis of the scalp, which we do see in dermatology. Hi, my name is Dr. Chama Osetutu. I am a board-certified dermatologist practicing in Brooklyn, New York. My main area of specialty is hair transplantation in patients of African descent, specifically scarring alopecia.
We know it costs a lot of money to get a hair transplant. If you have any texture to your hair, any curl, do not go overseas for a hair transplant until you see a dermatologist to get a proper diagnosis and a treatment plan established before and after treatment. If you're a woman with hair loss, just make sure that they will not shave the entirety of the back of your hair.
And if I may add, Mina, 80% of female patients are not really good candidates for hair transplant. Most women with hair loss need medical treatment first.
Hi, my name is Dr. Meena Singh. I'm practicing hair transplant in Kansas City for the last 13 years. I attended Harvard Medical School and did a special fellowship in hair transplant in New York City. I specialize in techniques in Afro-textured hair and scarring alopecias.
If you're choosing to travel abroad, you do need to understand the credentials of the surgeons. Unfortunately, I'm seeing more complications with people with Afro-textured hair who come back with interesting hairline and depleted donor regions, and it's really sad, actually. Hi, I'm Dr. Elioja Chimugu. I'm a hair transplant surgeon and a pediatric surgeon based in London. I have been in the hair restoration field for the last 9 years. I particularly enjoy doing hair transplants with a fine needle technique.
Yeah, most of the patients that we see coming from those clinics are completely devastating donor area that is completely destroyed, recipient area that is completely scarred. Unfortunately, most of these patients, we cannot fix them. So better to do your homework before than being sorry later.
And I had an interesting patient who did have a hair transplant abroad, seen 6 surgeons, and I was the first person to use a trichoscope on his scalp. Doesn't that worry you?
Yes.
But it's so disturbing where we do have brilliant colleagues, but yeah, in my country, it's not well regulated. So patients are at risk, really. So
if you are going to get a hair transplant, you need to go see a dermatologist who specializes in hair loss. Done.
You need to know what the background of the doctors and the team that will be operating on you, because most of these places do not have any qualified medical personnel to operate on you.
We can recommend amazing surgeons in the countries that you want to get a hair transplant. We all have colleagues that are amazing.